Careful to chew that.
A newborn struggles against a deadly condition.
What we're seeing is a small little area that looks like it's bleeding.
A heart attack survivor faces the loss of a leg.
It looks like it's really infected.
The sickest patients in the most dangerous circumstances.
Because we're trying to save that leg.
See what happens when nurses come to the rescue.
So do you want me to go run down there? Vinny, I'm going to run down and ask.
The patient is in intensive care.
We're in the ICU, okay?
When anyone hears those words, they know it's serious, maybe even a life or death situation.
Are you having any pain right now?
In the high-tech, high-tension atmosphere of the intensive care unit, it is the nurses who keep these patients alive and well. It takes constant vigilance, finely tuned skills, and compassion. It also takes a nurse who likes a challenge. Just ask Lindsay Cole.
I'm going to sit you way up, okay?
The sicker they are, the more fun it is to take care of them. Is there something wrong with that?
This gas, she's on 7.
Lindsay works with Jen Connors in the Surgical Cardiac Intensive Care Unit, or ICU, here at Masschusetts General Hospital. Heart surgery patients come to this unit straight from the operating room.
You don't know whether they're going to live or die. Like, I've always liked that.
Listen, don't worry about it.
That's part of the gratification of it, because you get someone that's so sick and unstable, and by the time you leave, you know, usually you can change that.
What are my tips, 30? I just like the action, and I like all of the technical stuff. I like all the lines and the invasive things.
Making sure he's eating and if he's comfortable, and those things are equally as important, but we're critical care nurses. We like the blood and guts and gore and adrenaline.
Jen Connors has worked in ICUs for 6 years. She's the charge nurse who makes sure every patient has a nurse and all the nurses have the help they need when they need it.
You don't feel anything down here, right?
What?
Do you feel anything down here at all?
It's starting to come back today.
Is it?
Pain and burning sensation.
But you can't feel my fingers?
Today, their patient is Doug Phelps, who had a heart attack when he came to Boston for his daughter's wedding.
It never hurt like that before. I held that.
He was having some discomfort and some chest pain at the wedding.
He came in for cardiac surgery, had a heart attack, had surgery.
Well, the honeymoon, needless to say, was just cut short.
But because of his history, he just has really poor peripheral vascular disease. So he's just had so many problems.
If the lack of circulation to his arms and legs gets much worse, it could be life-threatening. So they will watch this patient for the smallest changes in his condition.
Now, how about a good cough?
He's got all sorts of little issues that combined make one huge issue, and a lot of things get overlooked if it's a different nurse taking care of you every single shift.
You know, it might not be forever that he's in the hospital. Maybe he could just...
To assure continuity of care, Jen assigns one nurse as his primary nurse.
Oh, no. Welcome back, buddy.
In this case, Lindsay Cole volunteered.
I just like him. I like his personality. We play off each other all day. Makes the time go by fast.
She don't like me, but she has to say that.
What kind of drugs did you give him?
C92. That patient isn't in there. Can you just... Part of my responsibility as being in charge is to kind of follow up with, help out with anything, know what's going on in the unit at all times, and if anybody's drowning and needs some help, I kind of have to go in and assist.
Both Jen and Lindsay are particularly concerned about the color of Doug's extremities.
What are you doing now?
We're just going to tuck a pillow to get you off your butt because it's red, okay? At the end of Jen's shift, she noticed that his right hand was starting to look kind of dusky, gray, cooler. She had a hard time getting pulses.
So Doug Phelps is rushed back down to surgery. If they can't restore the blood flow, he could lose his arm.
They took out a big blood clot from his arm, and now his hand is probably doing a lot.